Good afternoon, everyone. I'm Dr. Anthony Foster, author and specialist in mindfulness, anxiety, and emotional fatigue, and your host for today's webinar. I begin by acknowledging the Wurundjeri Woi Wurrung people as the traditional owners of the land on which we stand to present this webinar, and pay my respects to their elders, past and present. I also extend that respect to any First Nation peoples tuning in today. On behalf of the Mental Health Foundation Australia and the CEO, Mr. Vasan Srinivasan, I would like to welcome and thank each one of you for attending today's National Mental Health Month event, which is an educational webinar on seniors' mental health. National Mental Health Month is an initiative of the Mental Health Foundation Australia, MHFA, to raise awareness and reduce the stigma surrounding mental health, as well as influence policymakers to make a meaningful difference in the lives of all Australians. Over the month of October, we have coordinated a range of mental health focused events in each state and territory of Australia. With this year's National Mental Health Month theme of building resilience, communities and connections, and we aim to bring all Australians together in a nationwide conversation about mental health. We have prepared a short video highlighting our journey so far. Please join us in celebrating the Mental Health Foundation Australia's National Mental Health Month campaign.
Hi everyone, I'm Vasan Srinivasan, CEO of Mental Health Foundation Australia. It is a privilege to lead this wonderful community-based mental health organisation in its 92nd year of establishment. The MHFA has grown strength to strength over the past few years, with Victorian Mental Health Month in 2018 to National Mental Health Month occurring in 2019, 2020, 2021 and this year in 2022. Our primary aim is to reach out to and educate as many Australians as possible to help reduce stigma and to encourage constructive and non-judgmental dialogue on Australia's critical mental health issue. The highlight of last year's campaign was reaching out to over 500,000 Australians all across the country for our national Walks for Mental Health, both virtually through our MHFA app and physically in some states. What a grand success that was. A large thank you must be given to the Herald Sun for their assistance with promotion of the month. In 2022, with the pandemic still affecting many of us, we decided not to give up once again, curating a carefully chosen blend of virtual and physical events for Australians to participate in, with the theme of National Mental Health Month 2022, Building Resilience, Communities and Connections. This year, we have launched our very own chatbot, available to assist Australians with their mental health around the clock. Our chatbot is available in up to 100 ethnic languages, with a primary aim to educate and support communities with their mental health.
Hi everybody, and thanks for joining me. My name is Peter Barlas and I'm the chairperson of the Mental Health Foundation Australia. Our foundation is really augmented by multiple supporters, and these partner organisations are critical to the work that we do. I would also like to thank ShareTree for working with us, of course, to use apps and technologies to improve mental health, and in particular I'm very proud to take on the app Emotional Pulse, and that's going to enable all those attending the Mental Health Month walk that we have set up on the 16th of October to do a quick check-in of their emotions. We're particularly proud also to partner with Australian business DB Results, once again looking at their app Am I OK? And that supports our members, volunteers and all individuals to check in regularly.
Thank you, Professor Barlas, for your leadership. This year, our MHFA Wellness Hub was officially launched on the 18th of March. Let us take a look at our hub.
This year, the Mental Health Foundation Australia established Australia's first of what we plan to be many mental health wellness hubs.
I would like to acknowledge the late Leslie Farrant, who left us a bequest which was instrumental in being able to set up this fantastic education centre in our hub.
Based upon and inspired by the findings and recommendations of the Royal Commission into Victoria's mental health system. For anyone who seeks our services, we ensure that cost will not be a barrier for them to receive the support they require.
A large part of our foundation is the provision of support groups. Many of our groups are hybrid, providing support to the community.
My name is Jim Gooden and I'm the Vice Chair of the Mental Health Foundation Australia. Now we offer our support groups here in the educational room of the Mental Health Foundation. All our support groups are in person and also using the latest digital and internet technology, as you can see. Now we offer 21 support groups for various mental health conditions, also multicultural communities and carers of consumers with mental health conditions.
I would like to thank MHFA board directors and patrons, scientific advisory committee members, IT advisory members, wonderful staff, community and media partners, attaches, youth and future leaders, MHFA members and major sponsors, Australian Unity, Chemistone, Perpetual Trustees, Put Solutions for their continuous support to this organisation. As we continue to work to deepen understanding of the importance of mental health, well-being and educating the community, let's work in solidarity for the benefit of our mental health. We look forward to celebrating National Mental Health Month with all of you. Thank you, Australia.
I would now like to introduce our presenter, Associate Professor Christina Bryant. Associate Professor Christina Bryant is an academic clinical psychologist, currently serving as a director of University of Melbourne's Clinical Psychology Training Program. She has many years of clinical and research experience in psychology, with a focus on managing long-term physical conditions and their impact on psychological well-being and the mental health of older adults. In particular, the prevalence and treatment of anxiety and depression, the relationship between attitudes to aging and anxiety, depression and well-being, and the promotion of healthy aging. She collaborates extensively with other researchers within and outside psychology and has published widely in international journals and books. Her recent work includes an intervention for depression in older adults living in residential care and interventions to support the carers of older people leaving hospital. Please join me in welcoming Associate Professor Christina Bryant.
Thank you very much for that very nice welcome, and thank you very much indeed for the organisers of this event for the invitation to come and speak to you this afternoon. It's a great honour and privilege to be part of National Health Month and Week, and in particular to be able to talk to you about promoting health and well-being in seniors. I'm just going to transition now to sharing my screen, which may take me a moment or two. If somebody could just give me the thumbs up that they're able to see the screen, that would be great. Okay, thank you very much. Very much with the theme of this year's mental health events in mind of building connections and resilience, I've called my talk "Maintaining Mental Health, Mental Well-being in Later Life," adding life to years, not just years to life. And I hope in my talk to pick up on that thread of the importance of connection. And I'd also like to start by just acknowledging the traditional owners of the land on which I work and live. I pay my respects to the elders of the Wurundjeri people, past, present and emerging, and particularly if there are First Nations people listening, thank you very much for allowing us to be here. So there's no doubt that we are adding years to life. Life expectancy in Australia is steadily increasing. It's always been a little bit higher for women than for men. That trend continues. And of course, most of us not only would like to live longer, but we would like to live happier and healthier lives. And there are many ways in which we can add life to years. And these are going to be very individual. For some people, it might be about being a master's athlete. For some people, it's about continuing to learn. For others, it's about the importance of family connections. And of course, these things are not mutually exclusive. But I suppose I want to sort of start by sort of having this idea that we want to live happier, more fulfilled lives as well as longer lives. And so what do we mean by well-being? Well, the Oxford English Dictionary defines it as being healthy, contented, or prosperous. Of course, the World Health Organization has its very well-established definition of mental health as a state of well-being in which every individual realizes his or her potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. And so, of course, already in there we have that theme of connection and community. One psychologist who's done a lot of research in this area of so-called subjective well-being has identified 3 components: satisfaction with life, experiencing positive feelings, and also not experiencing too many negative feelings. And I'll talk a bit more about that when I talk more about depression in a few minutes. Now, of course, it's also important to know what, not just what academics think, but also what older people themselves think. And this is one of many studies, but one that I do like to talk about. It's a qualitative study, so that means that rather than people just being asked a bunch of questions in questionnaires, a researcher sits down with them and really explores in depth their thoughts about a topic. And the people who were in this study were asked about what did they think may make for a happy and contented old age. And they identified 2 primary themes: self-acceptance and realistic self-appraisal. And so this is the kind of idea that it's important, for example, in this quote, accepting what you are at this time, not dwelling on what you could have been or things you want to do but are no longer capable of. So it's that balance between, as I've said, acceptance and realistic self-appraisal. And then the other side, the other theme that really emerged was the importance of engagement, self-growth, giving to others, having a positive attitude. And so this was kind of captured in this quote: you cannot always do the things you did do, but there are other things you can do and you need to look for them. So again, that idea that happiness comes from being engaged and having a sense of contribution. One academic whose work I very much admire is Christine Stevens, who's based in New Zealand. And she talks about the importance of being able to do the things that you value. And so she calls this a capability approach. It focuses on what people want to be able to do. And it doesn't deny that as we get older, some things do get harder. Knees get a bit creakier, and probably all of us find that we're perhaps a little bit less sharp than we once were. But nevertheless, there is much that we can still do. And there are certain things that can support us in doing the things we want to be able to do. The importance of physical comfort, security, having having sufficient resources to live, healthcare system that will look after your needs, being able to contribute. And for her, this is not necessarily productive. You might recall that the WHO definition of well-being or mental health kind of quite emphasized the importance of working productively. She sort of says that there are many ways that we can contribute, and of course we know that that seniors are huge contributors to voluntary work, and those kinds of contributions can help with social integration and also increase our enjoyment. And many of us also value autonomy, being able to retain some independence. So if we sort of have another look now at well-being, yes, it is important to be healthy, and physical health and our cognitive, or what's sometimes called brain health, is certainly important. Most of us would prefer the idea of becoming older and retaining our ability to remember and work things out, being independent and able to make our own decisions, being contented. So that in order to be contented, we do need to have some positive feelings. Doesn't mean to say that we need to be happy all the time, but with that may go self-acceptance and a realistic self-appraisal. And again, the importance of being connected to people and activities that you value, making a contribution that isn't necessarily productive in the strictly work sense of the word, and that can all give rise to a sense of purpose. Martin Seligman, who's made quite a name for himself in the so-called positive psychology world, has developed what he calls the PERMA model, where P stands for positive emotions, E for engagement, R for relationships, M for meaning, A for accomplishments. And that is, I think, quite a neat way of capturing some of the elements that could contribute to well-being. So there is some good news about getting older. We often tend to think that that it's all downhill and about decline. But in fact, when you ask people how they feel about themselves and their health, so this is data based on the Australian Bureau of Statistics. Even people over the age of 85, 2/3 of them rated their health as good, very good, or excellent. And this is sometimes being called the paradox of well-being in old age, that most older adults are actually satisfied with their lives. And only 9% of people aged 85 and over reported high or very high levels of psychological distress, which is in fact the lowest rate of any age group in that particular survey. And one of the take-home messages that I hope I would like to convey this afternoon is that it is not normal to be depressed just because you're old. Sometimes we encounter an attitude in society, and sometimes even in seniors themselves, that there is something inherently depressing about being old. That is not the case. It's not to say that, as I said before, not everything works quite as well as it once did. But it is not the norm to be depressed. And I'll talk a little bit later about why I think that's really important to have firmly in our minds. So in fact, this chart, I'm not going to go into it in great detail, but basically what I want you to see here is that if you look at the 3 different age groups, four different age groups represented here, there's a fairly steady downward decline in the prevalence of both anxiety and depression in people from midlife onwards, right through until the mid-70s. And then there's a slight uptick in the likelihood that somebody might experience anxiety or depression. And we'll talk in a moment about why that might be. But again, I think the message here is it's not statistically the norm either to be depressed when you're old. I would love to be able to spend more time talking about the importance of brain health, but I'm just going to very briefly mention that I think for many of us, part of a rounded sense of aging well would be to be able to prevent dementia. And as I said, that would be a sort of another whole talk in itself. But I would just like to sort of present the idea that there are some things that we can do that will help promote good brain health. They include diet, especially now evidence for the Mediterranean diet. Please don't smoke. Regular exercise. And then, of course, the things that we're going to talk about a little bit more, the importance of mental and social activity, and staying engaged with other people and with things that you enjoy. And as I said, I wish we had a bit more time to talk about that, but I know that today the focus is a little bit more on other aspects of mental health. And so I'm going to come on now to talking about how can we maintain our mental and emotional well-being. And I suppose starting by talking about, in a sense, the opposite of that, which is depression. Now, depression is the way in which it presents is fairly similar to the way in which it presents in adults. But sometimes it's been said that older people can present with depression without sadness. And what is meant by that is that sometimes if you ask an older person, are you feeling down or are you feeling sad? They will say, no, not really. But then when you ask them whether they are still interested in things that they used to do or are able to enjoy activities or are still keeping in touch with friends, they'll say, oh, no, I just can't be bothered with that anymore now. And so it seems that if we're asking older people about how they're feeling, we need to go a little bit beyond just that simple question of, are you feeling down or how are you feeling today? And there are some types of depression in older people that are more likely to include features like slowness, just not being motivated, reduced interest, and this has sometimes been called an executive dysfunction syndrome. So the idea being that our sort of frontal lobes, which are generally very strongly involved in helping us organize our behavior, are a little bit more affected by this kind of depression. We also know that in older adults, there's a very high co-occurrence between physical illness and depression. But it can also, again, and this goes to my earlier point about, we need to kind of probe a little bit more sometimes when we're asking older people about how they're feeling. It can be quite difficult to differentiate symptoms of physical and psychological distress. So, for example, if you ask an older person who's in hospital how their appetite is, and I remember this from many years of working in the public health system, asking older people in hospital how their appetite is, and they would say, oh no, it's pretty bad. But then when you saw the food that was being served, it wasn't really too surprising. So again, I think just don't take no for an answer. When you're asking some basic questions, you might need to probe a little bit more. And again, in keeping with the way depression sort of looks in younger people, the risk factors for depression in older people are fairly similar. These are probably quite sort of these are what I sometimes call the usual suspects. Life events, a lack of social support. Women right across the lifespan are at greater risk of experiencing depression and anxiety than men. financial insecurity, living in residential aged care. So there are very high rates of depression and anxiety in residential aged care facilities. But don't just jump to the conclusion that that's as a consequence of being in care. Depression is also a risk factor for being placed in care because of the way in which depression can affect people's motivation and ability to engage, for example, in rehabilitation when they've been unwell. Lack of physical activity, and really of paramount importance in later life, physical health. And here we're sort of understanding more and more about the role of inflammatory processes that are involved in a whole range of different diseases, depression, dementia, autoimmune diseases. And one particular type of depression that we see in older adults has been called vascular depression, and I will talk about this in just a moment. So this is a kind of depression that has more of an organic cause and is perhaps a little bit less related to some of these risk factors that I just mentioned. Depression can be quite strongly associated with cognitive impairment in a number of different ways. So as I've said, there's this entity called vascular depression, where there is damage to the vascular damage to the structures in the brain that gives rise to depression that has a slightly different symptom profile from other depression. Depression, of course, can also lead to cognitive impairment or subjective memory complaints. This is true not just in older people. I mean, anybody who's experienced low mood will know that it can make it much more difficult to concentrate and to make decisions and so on. People with cognitive impairment can, of course, also still experience depression in reaction to perhaps receiving a diagnosis or to declining cognitive functioning. And in fact, people with Alzheimer's disease are at high risk of depression. And again, there may be a common pathway by which inflammatory processes are related to both Alzheimer's disease and depression. It's important to touch on this. It's a difficult topic, I know, but old people do have high rates of suicide. And of course, rightly, we've been very concerned about high rates of suicide in the young and particularly young men, but old people do have high rates of suicide. A suicide attempt is more likely to be completed. This is partly because, let's say, an older person takes an overdose. There's less physical reserve, there's less physical buffer. They're also more likely to use more lethal means. And I find this quite a chilling statistic that in the United States, 80% of older male suicide is by the use of firearms. The risk is greater for people who are over 80 if they experience physical illness and are in pain, recent stroke, and bereavement. And interestingly, and again, this is not just true for people who have suicided in later life, but also in to some extent in the younger years. 75% of those who had completed suicide had visited a GP in the 4 weeks prior. But of course, they may have found it difficult to have a conversation about how they're feeling and about their emotions. They maybe went to the GP saying that they were in pain or that their knee was playing up more. And of course, this again goes back to my point about the importance of asking questions that probe just a little bit more, perhaps. So older men over the age of 85 have the highest risk of suicide of any age group. And there's a particularly, I suppose the word to say really is dangerous profile, a particularly risky profile. And that is people who feel isolated and disconnected and feel a burden to others. And this has been shown in a number of research studies that particular combination really sort of heightens risk. And again, goes very much to, the theme of the importance of connection and community. So I've already said that physical illness and in particular cancer can increase the risk. We don't yet know what the impact of COVID is going to be, but research shows that there was an increase in suicide both after the Spanish flu epidemic and after SARS. So I think that's something for us to be on the lookout for. This is picking up on one of the questions that came in. Is retirement good for your mental health? Interestingly, I was teaching a class of young students yesterday, and one of them asked me precisely this question, and I thought, well, I better go away and find out a bit more about this. So I did some sort of quick research yesterday. So most studies say that it is, particularly in the short term. And that's probably partly because a lot of the studies haven't really followed people up for years and years and years. But there is a suggestion that maybe there's a honeymoon phase when people retire. But the studies do find that retirement is good for your mental health, particularly if you're retiring from a job that was highly stressful or sort of put you in a poor environment. But of course, there are always going to be individual factors. Was the retirement voluntary? Was the retirement because of poor physical health or because of mental health issues? Did somebody need to retire because their depression made it very difficult for them to work? Is the person retiring in order to care for a family member? Those kinds of factors are likely to make the retirement less unequivocally, not quite so unequivocally good for your mental health. And, for many of us, work does provide a sense of connection and purpose. And when that goes, that may be quite challenging. So it sounds like, is retirement good for your health? Probably yes, but it also depends on individual circumstance. So what can we do to prevent depression? Now, everybody has ups and downs, but depression is a serious condition. And how do we know it's depression and not just not one of life's ups and downs? Well, probably low mood that you can't shake off, losing interest and enjoyment in things that you used to enjoy, changes in sleep and appetite, feeling that life isn't worthwhile. And as I've said before, I really just think it's so important to get this message across that it's not a normal or understandable part of getting older. Some of the things that happen to us as we get older may increase the risk, as I've already said, things like physical illness and pain. But that doesn't mean that that we should then just dismiss depression. Depression is a treatable condition, and it's also important because it's a risk factor for getting dementia. So that's another good reason for addressing depression. So what can we do? Well, it is really important to maintain physical health and manage health conditions as well as you possibly can, especially those that limit activity or are painful. because if your activities are limited, it also limits your opportunities to do things that you're going to enjoy and that help keep you connected with other people. Make sure that your blood pressure is checked. Some types of depression in later life, as I was saying, the vascular depression is linked to high blood pressure and mini strokes. Regular physical activity, engage with people and activities that you enjoy, the importance of mental stimulation, maintaining a sense of purpose, having things to look forward to. And I know that many people in later life are carers for children with disabilities, for a partner. If you are a carer, try to get as much support as you can so that you can look after yourself. As the saying goes, you can't pour from an empty jug. And so here's an example of, this is a story that was featured in the Age newspaper a couple of years ago, and I was asked to provide some commentary about this. I think this is a nice example of combining social and physical activity. These men are the Fab Five, who meet regularly for a swim. I think that might be the Harold Holt swimming pool. I can't quite remember now. They meet for a swim, and then they go for a coffee, and they talk about world affairs, and that apparently there's no pretentiousness, there's no baggage. We are who we are. We met by circumstance, and we talk about anything and everything. We solve the world's problems over a cup of coffee every Friday, but the authorities just don't listen to us. You get a bit of exercise, meet some nice people, have a bit of a chat, and then you go to work. So they're probably still fairly active. And then I got old, my bones started to creak, back ached, and I was having knee problems. So I thought I'd better take up swimming. So, here we see a bunch of men absolutely doing, ticking many of the sort of the right boxes in terms of looking after their mental health. So picking up again on some of your questions, it can be very difficult to get help. Your GP will be the starting point. They can direct either to mental health services, which are available in every area, although of course I know that they're very stretched. Referral to psychologists and counsellors. What to do if a person is hesitant? Well, explore the reasons why. There's usually some kind of reason. They've perhaps had a previous bad experience. Perhaps they might also have some misconceptions. Oh, I'm going to be given antidepressants and then I'll never get off them, or the antidepressant's going to be addictive. I think it's fair to say that people may need to try a few psychologists before they find somebody who's a good fit. And so people need to be aware that going to see a psychologist once doesn't lock you in for life. When you go to that appointment, go with questions. Ask, what can I expect? How many sessions will we have? What's the cost? What kind of treatment will we do? And if you're not satisfied with those questions, you don't need to go back. Some psychologists do bulk bill. I know it can be quite hard to find them, but there are some psychologists who bulk bill. And again, I know it's very hard because we put so much on our GPs, but GPs will have referred to psychologists and counsellors and had feedback from their patients about the ones who were found to be helpful. I just want to talk briefly a little bit about anxiety disorders. They tend to get a little bit of short shrift because they're sort of a little bit eclipsed, I think, by depression and to some extent dementia. This is a picture that I took some years ago when I was in Bangkok. I'm not sure that anxiety shortens life, but it certainly makes it less enjoyable. We can say that for sure. and as I said, we tend to neglect it a little bit, I think, compared to depression. But it is important because, as I said, it's very unpleasant, but it also leads to poorer outcomes of hospitalization, increased risk for disability, increased use of health services, reduced enjoyment of life, decreased cognitive and social functioning. And there's now increasing evidence that anxiety may also increase our risk of dementia, because when we're anxious, there are all sorts of neurotransmitters squirting around that may not be very good for the brain, and this probably goes back to many decades before any kind of evidence of cognitive impairment becomes apparent. I'm just going to focus a little bit on some anxieties that I think are specific to older people. Fear of falling is one that I came across a lot when I was working as a hospital psychologist. It's one of the commonest fears of older people, can develop in the absence of a history of falling. And unfortunately, one of the problems with it is that it, because people are so afraid of having an accident, it leads to this cycle of avoiding activity, becoming less able, more and more restricted, and so it can have really quite negative consequences. It is treatable, yes, maybe we might have time perhaps in the questions to talk a little bit about sort of psychological treatments. I've already said that in the sort of when people have dementia, they're at risk for depression. That's true for anxiety as well. It may decline as the disease progresses, might be more common in vascular dementia than in Alzheimer's disease. It's very prevalent in people with Parkinson's disease. And in fact, anxiety is twice as prevalent as depression in people who are caring for a family member. So yes, we know that around 25% of carers meet criteria for an anxiety disorder, and that increases as the disease progresses. So I'm assuming here that we're talking about people who are caring for somebody with something like dementia, whereas the prevalence of depression is lower. And there are things that can help. There are online and a number of different resources that people can use to get help, that really need to kind of focus on helping to manage the challenging behaviours that can sometimes be shown by people with dementia. I want to just sort of mention briefly the importance of attitudes and our outlook. Positive attitudes have been shown to really have long-term benefits, even on things like cognitive performance, engagement in healthy behaviors. So I guess the thinking here is that if you have a positive belief that that old age is going to be an active time for you, then you're going to be more motivated to look after your health. And it's even been shown that people with more positive attitudes towards aging actually live longer. And in some work that I did some years ago, lower levels of depression. And unfortunately, we live in a society where there are a lot of negative stereotypes about aging, a lot of ageism. And if we internalize those attitudes, that might reduce our motivation to be involved in activities that promote health. And so this is, in fact, from one of the studies that I did, I go horse riding and bike riding. I have more freedom than I had bringing up 4 children. I'm 69 and enjoying every minute of it. And another participant who said, why not ask what exercise people do? For starters, I ride a bike for 250 kilometers a week. That's a lot. And play tennis once a week at least. And so you can see how these people have this kind of positive outlook that also helps to keep them healthy. But having said that, I think it's important to say that our genes play an important part in how we age. Sometimes people do everything right and still develop heart disease or Alzheimer's disease, or are disabled by an accident, or have to live with a long-term disability. So I just think it's really important not to blame yourself or other people if that happens. And you know, we live also in a time where there's quite a lot of talk about successful aging, healthy aging, positive aging, productive aging, and that might make it seem that declines in health are actually a failure. And I think, you know, we need to recognize that everyone is going to have some declines as they age. Accepting these is perhaps the art of aging gracefully. But we can learn from people who age exceptionally well. So you may have heard of the blue zones. So there are a number of areas in the world. The Seventh-day Adventists who live in Loma Linda in California, people of Okinawa in southern Japan. I think there's another group in a part of Turkey that they and so these are groups of people where a large proportion live to be over 100. And when you look at what they have in common, they engage in regular physical activity. They have plant-rich diets with plenty of legumes. They have positive psychological traits such as optimism and resilience. They have a sense of purpose. And finally, family, social, and spiritual engagement. So again, that importance of connection, resilience, connection, community. Yes, I think, you know, here are just some sort of images of positive aging. Finally, my sort of key messages really are: it's never too late to increase your healthy behaviors. They include being physically active, have checkups, consider your diet, engage in meaningful activities and relationships. Anything that's good for the heart is going to be good for the brain. Sorry, there seems to be a little, yes. Adopt positive but realistic attitudes. Be kind to yourself, be flexible, adapt to age-related changes rather than being resentful of them. Stay open to new experiences, and try combining activities. So, you know, like that example of going for a swim and going for a coffee and having a chat. And I think that might be where I'm going to leave it. Please feel free to contact me. That's my email there. And I'm also, I'll be guided by our MC as to questions. But thank you very much for listening. And shall I stop sharing my screen now? Good, right.
Thank you very much, Professor, for such an informative and interesting presentation. Now we have some questions from our audience, and although I think in part you may have answered some of these, but here they are. How big of an impact does retirement have on the seniors' mental health?
Sorry, there's a building site just outside my room. That was the question about retirement, was it?
Yes. What is the impact of retirement?
Yes. I mean, as I said, I think you know, it looks like the sort of the evidence is that it has a positive impact. Particularly, I think if people have prepared for it. and can retain some meaningful and activities and engagement. I think where retirement could have a less positive impact would be if it's a consequence of physical or mental illness, if it's been forced upon somebody sort of outside of their choice, perhaps also if they're retiring in order to do something equally stressful, like looking after an unwell family member. Psychologists love to say it depends, but I think that is actually true here.
Absolutely. Another one, if you know someone who could benefit from a chat with a psychologist, let alone a medication, but is resistant to the idea, what can you do?
Yes, I mean, I tried to kind of touch on that a little bit by sort of saying, I suppose the bottom line is that at the end of the day, as the saying goes, you can take the horse to water, but you can't make it drink. But you can also try to make the water more attractive by trying to explain some of the things that I mentioned, like, you don't have to like the first psychologist you go and see. You can ask questions, explore the reasons why they're hesitant. Maybe there's been some bad experience in the past that is now a barrier, or and I know one of the questions kind of particularly highlighted the difficulty for some men in reaching out for help. So I think sort of talking about how, it's good to be strong, but you don't have to be stoic. The old sort of Japanese proverb, it's the bamboo that sways is stronger than the oak that snaps. So being able to be a little bit flexible and acknowledge that asking for help isn't a sign of weakness, but actually a sign of strength. And I suppose also, that we do know that particularly for people who live in rural areas, there are really big barriers to accessing suitable services. But I suppose telehealth does provide a little bit more option now than we used to have. But I think it really is about trying to explore the sort of the underlying, what is it that they're actually afraid of or concerned about. And as I said, maybe there are some misapprehensions about, oh, they're just going to give me antidepressants and then I'm going to get addicted to them or something like that.
Well, on the subject of men, and how can we provide a better support for the rural-based men who are at a greater risk of declining mental health and its impacts on them?
I mean, of course, that's a big question. We know that there's lots of discussion about how to encourage medical doctors to go and work in rural areas. One of the things that we're doing at the university is really sort of trying to increase the number of placement experiences that we're able to offer in rural and regional areas, because we find that sometimes when students have those experiences, they realize that actually this can be a really interesting place to work. So I think we need to I think there are workforce issues that we need to address. But I also think that it's how we work and the kinds of services that we offer. So, for example, and again, I don't want to kind of indulge in in unthinking stereotypes, but men may not sort of like as much to just sit down with somebody and talk about themselves. So things that are more activity-based. Of course, things like men's sheds, but possibly a men's shed that has, you know, an opportunity to talk with somebody, or some other kind of activity that can be blended with something that's more sort of counselling related. I just think we need to be a bit more creative, but it is also, you know, I think there's a cultural issue, there's a workforce issue, and then there's trying to you know, be more appropriate in the way in which we work.
We've only got a couple of more questions for you, but how can we adapt the general therapeutic therapies to better meet psychological needs when working with elders?
Yes. So I kind of was thinking a bit about this when I was sort of talking about fear of falling and how we can work with that. I don't think we need to exaggerate the extent to which we need to adapt therapies for working with older people. It's certainly true that if somebody is either in sort of advanced old age, you know, 85 plus, and frail, then, you know, encouraging them to take up a new physical activity is clearly going to not be very appropriate. And clearly when somebody has, you know, more than mild to moderate memory impairment, doing therapy is going to be difficult because it will be harder for them to remember the content of what's been discussed. But I think by and large, my experience, and I think I can truthfully say it's fairly extensive, experience of working with older adults is that it's more similar to working with younger adults than it's different from. And yes, you know, we might perhaps take things a little bit more slowly or spend a little bit more time explaining what we're doing, because some older people are less familiar with this whole kind of psychological world, if you like, than the younger generation. But I think that you know, there is plenty plenty of psychotherapeutic approaches that we can use with older people that is not that different from what we would do with a younger person. The bigger challenge, I think, really again is a workforce challenge that, and I know this, you know, firsthand from the students that I work with. The majority of them would like to work with adolescents and young people rather than with older people. So I'm always on a little bit of a campaign to try and interest them in working with older people, because I've found it incredibly rewarding.
One more question. What is the primary driver of depression in seniors?
Well, as I said, I think there's probably no one primary driver, but certainly physical health is a big factor. And I think loneliness and isolation is another big driver. And I think possibly, and this is perhaps not so much a driver of depression in itself, but could, in a sense, you know, make the situation worse. Possibly reluctance to seek help might mean that depression is more likely to go untreated. But I think in terms of the primary drivers, in the sense of what causes it, I would say that it probably would be the impacts of physical health, pain, loneliness, and isolation.
So the last question for you is, what are the main sources of stress and anxiety in seniors?
Well, again, there are probably very, very many, and depending on circumstance. Obviously, if somebody is living in insecure accommodation, their fundamental worry is going to be, where am I? Am I going to be able to pay the rent? Am I going to be able to be here in a month's time? Those kinds of fundamental concerns have to be taken care of before any other. But I think the kinds of things that if those basic needs are taken care of, that that older people worry about, sometimes it is about, are their family cared for? Are they able to support their families in the way that they want to? They worry about their health. I think a lot of older people are also worried about the state of the world, the environment. And the research shows that if you ask younger people and older people what they worry about, younger people are more worried about their own goals and concerns, and older people are more worried about the people around them. So probably family stress can also be a factor for anxiety.
Thank you so much, Professor, for all your insights and for answering the questions from our audience.
You're very welcome. Thank you very much for the invitation.
Now, I'd like to take a moment to thank each one of you for joining us today for what I think has been a very highly informative webinar on seniors' mental health as a part of our National Mental Health Month campaign. With just 17 days left in this month-long campaign, we encourage you all to have a look at our calendar of remaining events, to share it amongst your family and friends, and participate in our cause to promote better mental health for all. We especially encourage you to sign up for our National Walk for Mental Health event, which is being held in each state and a territory, Australia, this Sunday, the 16th of October. If you're in Victoria, the walk at Albert Park Lake will be followed by a vibrant multicultural festival with music, food stalls, and entertainment. So please come along, get your joggers on, and walk for mental health. Please join me now in viewing this short video on our walk for mental health.
Australia, are you ready for a challenge, and that too for a good cause? Then look no further. Join the Mental Health Foundation Australia as we walk for mental health across the country on the 16th of October at 10:30 a.m. in each state and territory capital. Worried about COVID? Well, we've got you covered. We've launched our MHFA app where you can walk virtually, raising funds as an individual or in a team. Visit our website for more information about getting started. So come on, Australia, our journey to better mental health starts with one step.
Lastly, I would like to mention that in addition to educational webinars, the Mental Health Foundation Australia also facilitates the monthly support groups for a range of mental health conditions. The MHFA also provides affordable and easily accessible counselling services through the Wellness Hub and the team of provisional psychologists. For more information on the National Mental Health Month campaign, as well as our services, please visit the website at mhfa.org.au. Now that concludes today's webinar. Once again, thank you all for attending. Bye now.